My name is Dr. Andy Reid, one of the sport medicine doctors here at Banff Sport Medicine, and I'm going to go through some of the considerations when you're having a hyaluronic acid injection today.
Take it easy for the next 2 days.
Hyaluronic acid is a molecule which we have in our normal joint fluid and around our connective tissues, our ligaments and tendons. And sometimes your physician will opt to use a hyaluronic acid injection for certain types of osteoarthritis and for certain tendon problems. The molecule works by providing extra joint cushioning and lubrication, and also by lubricating tendons and promoting healing. Hyaluronic acid injections are generally very well tolerated. They are efficacious. They're effective in up to 70% of arthritic joints, although we do know that about 30% of patients are non-responders for whatever reason, and we don't really understand why. The advantages that hyaluronic acid has over steroid is that when it works, it typically has a long-lasting effect. We know that most patients will get at least 6 months of benefit, and in some cases, you may get as much as a year out of an injection. The other benefit of hyaluronic acid is that it's very safe, and there are really no long-term adverse effects either in joints or around tendons. The cost of hyaluronic acid is a little more than some of our other injections, and it varies between $200 and $500 at our clinic, depending on the exact brand and the volume of the injection. In many cases, if you have additional insurance, the cost, or at least part of the cost, will be covered. But if you don't have additional insurance, then unfortunately you will be paying out of pocket for these injections. The advantage, as I've already mentioned, is that these injections can be quite long lasting, so you may feel that the additional cost is well worth it if you get 6 to 12 months of benefit. In terms of preparing for the injection, there's no specific preparation needed before a hyaluronic acid injection. The physician will clean the skin with an alcohol swab. They may apply a local anesthetic, and the injection will be performed. After the injection, we recommend that you take it easy for 2 to 3 days afterwards. Most patients don't experience any major issues, but it's quite common to get some increase in your pain and some mild swelling for a day or two. And some patients do get stiffness in their knee or their hip immediately after a hyaluronic acid injection. The onset of action is a little variable. We see that most patients will notice benefit within about 2 weeks, but in some cases it can be longer. And in some cases, patients do start to feel better within about 7 to 10 days.
A little poke in the side of your knee here, okay?
For the injection procedure itself, we commonly have to use a larger needle for some of the hyaluronic acid preparations. So typically your doctor will apply a little bit of local anesthetic at the site of the injection to minimize pain during the procedure. We often use ultrasound to confirm that the needle is in the correct place and to ensure we're delivering the hyaluronic acid to the right spot, but that isn't always necessary.
Okay?
Yeah.
After an injection, it's important to keep the injection site clean and dry, as there is a very small risk of infection. I recommend that you stay out of hot tubs and rivers and creeks for 48 hours just until that little poke has healed over. Signs of infection can include increased pain, redness, swelling, and discharge from the injection site. And if you experience any of these, then the best thing is to contact your physician. Hyaluronic acid injections have a slightly slower onset of action. I'd recommend that you give it up to 4 weeks before following up with your physician if you feel that the injection has not been helpful. But as I say, most patients do experience benefit within 2 weeks, and the effect can be quite long-lasting. I recommend that my patients follow up with me when they start to feel that injection wearing off. And hyaluronic acid can be administered at 6 to 12 month intervals, or really as often as the patient needs it, and there's really no long-term adverse effects. These injections can be effective ongoing for years and years.